in the hospital, we'll get bigger trays, like this big. We'll have a tray of all your tubes and all your equipment that you need. But for now, we're gonna use this. This is what you guys are gonna use when you'll come to your lab skills. I'm gonna put one of these, or you can actually pack them the day before, so that it's ready to go when you come in. But I'm gonna have all the equipment on the middle table, so that I'm gonna give you some time, like a couple of minutes to pack or to organize the equipment that you need for the test that you need. But before we go in the room, usually at the door, there is there's a lot of signs. You can't just go in, okay? Especially in the hospital, because if that patient has something that's very contagious, you want to make sure you are protected with your PPE. You want to make sure you know what kind of PPE you have. Things like tuberculosis, that is crucial. If you don't wear N95s, they will fit you with N95s at your orientation, because N95s comes in different sizes, okay? And so if it's a gap, if it's too big for you and you go in that patient's room, there's a risk of you inhaling, so you'll contract the TB. Okay, so we want to make sure that we have the right equipment. People who have C. diff, we have the double glove, because that's very contagious. Do you know what C. diff is? It's Clostridium difficile. Basically, it's a GI problem. You're going to have diarrhea constantly, and that is very contagious. Okay, it's something to do with, I guess, you might ate something or contracted some bacteria from somewhere. I don't know. But you got to make sure before you go in the room, the door, you got to see signs. They will put signs out for each patient. Some patients you don't need. If they're just going in and you can just go randomly. We all have to wear masks nowadays. Before we don't. But before you have to, it will tell you if you have to wear masks, your gown, your gloves, whatever you need. But now everybody needs to wear masks. But as I say, because I haven't worked in a hospital for a while, I don't know what kind of mask everybody has to wear. Maybe everybody has to wear N95 now because of the Omicron. Okay, so they may have changed that rule. So masks like these, they may not let you wear those, but I'm sure they'll provide them. Okay, so you just got to be aware of what is on the door. So if for blood culture, what do we have to wear definitely? So if it's a FUO, fever of unknown origin, we have to wear a mask because they have a fever, it's contagious. What kind of mask? I don't know, but you have to wear a mask, okay? We always wear a lab coat anyway, and then gloves definitely. So, knock knock. Good afternoon, my name is May, I'm your phlebotomist today. Is it okay to draw your blood? Okay, thank you. So I will check.
When you put it in there.
Okay. My name is John Smith. Well, obviously, we won't be doing this. Okay, John Smith, JOHNSMITH. You don't have to do it loud, but if you want to do things to help yourself, you can, but just not so loud. You do it so that is like you're teaching the patient. So birthday is 2/15/1982, MRN is 234545788, and this procedure you have to do. If you don't ID this patient, you'll get a big 0. Doesn't matter if you do the procedure right, get 100% right. You don't do this part, you will get a 0. Because ID is the most important part of our job. Okay, great. I'm gonna do a blood culture today. So I've just washed my hands. I'm gonna put some gloves on. Oh, should have put some gloves on before that, actually. All right.
Before I do, you have to remember.
Yes, I've already done that, okay? So before we come in the patient's room, we usually, when we go up in the hospital, we usually put on gloves on before we see the patient. But for the test, if you want to, you can put it on in front of the patient, okay? All right. my form. Okay, I don't need that right now. I've also got to make sure my label here is correct with all my form is correct with my labels. Okay, but sometimes I do make a mistake. You never know. You got to make sure they're correct. Okay, we're doing a blood culture today. Can somebody also grab me another tube? Any tube will be fine. Thank you.
Oh, you got it?
Oh, got it. 1, 2, 3. Okay, usually blood cultures comes in a pack like this without the stain. And it will have your bottles in there. It will have a specimen bag. And it will also have a antiseptic. Okay, I got one, but I don't need that. I also have one of these, okay, that will attach your butterflies to. They may not usually have a butterfly in here, which means you have to get your own, which I did somewhere, right here. Okay, I don't need my specimen bag yet. So I will organize myself. Make sure you have the bed roll down, because you can't draw like this, okay? I don't need the bag yet. Everything where? Where should it be?
On the left.
Left side. Okay, I want to make sure which is aerobic and which is anaerobic. This one says, this one's aerobic, okay? So this one's anaerobic.
Would you want us to make the lines like they did in the video? No.
If you're going to be doing a lot of these in the hospital, you don't have time to make lines. When you are drawing blood, I see some of you are still doing this. The blood doesn't come out that way. If you put it like this, you can see the blood coming in. Same with this bottle. You want to put it straight so you can see where the blood's coming to. And you know your liquid or your additive is here. So you got to fill no more than 10. Okay. Same thing. Oh, can I get a tourniquet? Thank you. I'm going to feel for a vein first to see if I can find one. Okay, they've got one right there. All right. What you need to do is pop off the cap. And then I am going to clean it. Try not to put your supplies by the leg, because patients sometimes kick it off, not on purposely. Okay. All right, I'm gonna set up my butterfly. Okay. I'm gonna retie the tourniquet. When we do this procedure, we gotta tie it pretty tight, right? But because we're gonna take longer than maybe 5 minutes, our time is 5 minutes per patient from start to finish, which means from ID to by the time they leave. That's 5 minutes. Okay. But because this procedure may take a little longer because all the things we have to do, don't tie it as tight as you would normally. Just tie it a little looser, then we can have it on a little longer. Okay. If I need to fill, I will fill. Okay. I don't need you to stand here and to do it for 30 seconds to a minute. You can tell me I'm cleaning the site for 30 seconds to a minute, okay? Then I know you know what you're doing. All right.
So we don't do like the guy do go this. That's it. Sir.
Okay, little poke. Grab our vacutainers. We're gonna grab our first bottle. Okay, gonna turn it around so we know how much blood is coming. Okay, we got enough. Second one. This is our anaerobic. We did aerobic first, now it's anaerobic. Okay, we got that already. How you doing? That's if they're awake. I'm gonna put our other tube in there. Okay. Tourniquet. Blood pressure, or if they're unconscious.
Wow.
Okay. If they're not unconscious, you get them to hold it. You do whatever you need to do. And that goes in the shop straight away. I'm gonna keep this one. All right. Okay, I'm gonna keep that one. So I am done. Make sure you take everything away. You can wrap the patient. Make sure you do not leave the tourniquet here and walk away. You need to take everything away as you come in. You can put the bedroll back up. Say I've tied him already. Okay, or you can let it clot and then finish off our things. What do I need on here? Where's my labels? I'm gonna throw this away so that I don't get myself confused with so many things here. And don't put your tray on the bed. You can put it on the tables or on those tables. Okay, I have John Smith. Okay, these labels are different. I will give you labels on your tests, so you won't need to worry about this. Also, when we draw the patient, we need to get consent, right? Make sure you do that. Even if they're unconscious, you still speak to them as though they are awake. I've got 3 tubes. What do we need to do on these labels?
Put which on?
Sign,
Sign.
date, 27th today.
Yes. Time.
And the time it is 10:36 a.m. Gonna do these on all 3 of these. Also, you gotta put left AC, blood culture times 1. Okay, BC times 1. There's not much room on here, but left AC, blood culture times 1 on all of these. Actually, on 2 of those, because the other one's for that. So I've signed. All right. Also, you have got to sign here. Doesn't matter anywhere. 10:26 a.m. Left AC, blood culture times 1.
Even though it's just 2 bottles.
Yeah.
This is one set.
This is one set.
Okay. If it's times 2, there's 4 bottles. Times 3, there's 6 bottles.
But one phone,
1 for this one,
one phone, so you can
another one for the other one. Okay. But you have to put times 2 because that's the second set.
So time 2, you have to wait 30 minutes.
No.
No?
If they have another vein over that
You
side,
have to do right
I can do it right now.
Okay.
If they have another vein over here, I can do it.
Okay.
But it's just some people may just have that one vein. They don't have anything else but that vein. Then you come back in 30 minutes.
Okay.
Okay. But if they have other choices, I can go and do it right now.
Okay.
After that one, I'll do the next one, then do the next one.
Okay.
Okay. So this is done. Put my labels on these. I am going to put it right here. We do not want to put it here We do not want to put it on the barcode. Get my specimen bag, put them in there. I have one more for my tube. And I didn't do a red. Why is that?
Because you drew it from the
Because I already took the tissue fluid out of this, right? So I don't need a red. Put my foam in the back. And remember, you have 5 minutes-ish to do this procedure, because we have 5 minutes per procedure, so you're gonna have 20 minutes for the whole thing. Take everything away. Okay, make sure everything's clean. Okay, thank you. All right.